First, we're here with Keith Allred. Would you please explain how Governor Keith Allred would help Idaho opt out of federal health care regulations?
The way to get the waiver is by adopting our own programs that we can show will contain costs and increase accessibility better than the federal legislation. So we got to be proactive and problem-solving oriented in developing those.
Okay. And it seems the provision assumes, or the waiver assumes, that states can do health care better than the federal government. Do you believe that? And if so, why?
I do believe they can. I believe in that fundamental principle in the Constitution that most state policy is better left to the state level.
Mm-hmm.
It's easier to find solutions to fit the needs of a particular state. A one-size-fits-all solution in a country of 300 million people is just pretty tough to do.
Right. The federal mandate requiring people to purchase health insurance has been railed on by many people across the political spectrum. Would you support a mandate such as that on a state level?
I think the first priority is to try to find ways to better contain costs and increase accessibility without the mandate. And so if we can find that, that would be great. If we have a choice between a federal mandate and an Idaho mandate, where we surround the mandate and define it in our own way, I'd prefer the state one.
Should the state become involved in healthcare, there will be those that argue that Idaho still shouldn't, even on a state level, shouldn't be involved in healthcare. What would you say to those people?
Well, I'd say then, how do you see healthcare costs being controlled, and how do you see access maintained?
Mm-hmm.
Because every year costs are going up and access is declining. This will break the budgets of Idaho families. It will break state budgets. I mean, we're involved whether we want to be or not, and it is one of these things that even aside from the very direct government involvement, we all pay the costs of the inefficiencies of the healthcare system. We show up to a hospital, and because there are a lot of uninsured that show up there in the emergency room and they don't get reimbursed, we end up paying for that. And so there is no solution to just say, hey, I'm going to be my own island and I'm going to be unaffected by that. We are affected by it now. The effect is a negative effect. To me, the role for state government is to do the things it can do to leverage markets. There are things we can do to organize markets so that they're more efficient, like we do with the stock exchange. You can do that with an insurance exchange. Right now, we do not have an efficient healthcare market, and there's a variety of reasons why you'll never have it on its own. It's kind of a unique sort of beast in the way the purchase decisions are being made, that you're not going to get it on its own. But you can follow paths more like the Utah path, where it is a closer to a truer free market exchange, that the government just establishes some ground rules so that you can make comparisons apples to apples and you can have good information, and then consumers can make smart choices, and that's the power of markets to control costs.
Now, you said that the state reforms would need the authorization of the state legislature, which is, of course, heavily Republican. How would you work with legislators to bring about the changes? Because it could be a tough fight.
Well, the choice is, do you prefer the federal version or the state version?
Mm-hmm.
If I've been hearing state legislators accurately, they prefer a state solution.
Mm-hmm.
So I don't think that Idaho legislators say, no, don't give us an Idaho solution, we'd rather have the federal one.
Okay. And one final question. Rasmussen poll released last week has you down by 32 points. Any response to that?
Well, you expect, if you're a Democratic candidate that is running for the first time in Idaho, to start at that point in March. Most Idahoans haven't tuned into the race yet. Our experience out on the stump is that Republicans are very receptive to our message once they understand I'm a different kind of candidate than they've seen from Democrats in the past.
Perfect. Thank you for your time, sir.